I'm super excited to announce this project that I've been working on. It came out of a need of where I felt really alone. It was the loneliest time of my life when I got diagnosed with breast cancer. The first question I asked my oncologist was, who have you treated that has my exact diagnosis? She couldn't find anyone. This is why I created this platform called Diagnosis Anonymous. Diagnosis Anonymous connects people who are going through cancer, newly diagnosed people, to mentors, people who have been down that same path. Go to diagnosisanonymous.com and join our waitlist to get matched to your mentor. You'll fill out a quick, easy form. You will get notified when you have a match. diagnosisanonymous.com. Thank you.
Welcome to Boobalicious. This podcast is about navigating life as a midlife woman. Your health, your body, your identity, and everything that shifts along the way.
From hormones to healing, including life during and after cancer, we're having the conversation no one prepares you for.
I'm Chris, a mom of 2 and a breast cancer survivor.
And I'm in perimenopause.
And we're figuring it out right alongside you.
I'm Jenny, a physical therapist specializing in women's health. Join us and subscribe. Hi, this is Jenny jumping back in for part 2 of our conversation with Uncancer, the team that brought you all of these incredible products for your oral health during and after breast cancer, menopause, the works. So if you didn't hear part 1, go back and listen to that. But with part 2, we're going to jump into the middle of a conversation where we learn what are the steps to take when you're first diagnosed and you're going to undergo treatment, but you're concerned about your oral health.
Okay.
Yeah.
So what are some of those ways what does that look like? And I know it depends on age and diagnosis specific, but.
Yeah. Robin, go ahead. The first thing you want to do is you want to schedule an appointment with your dentist.
Okay.
As soon as you're diagnosed, you want to know, do I have any areas of concern? You want a thorough cleaning. You want to get set up on a regular protocol or regimen where you're in every 2 to 3 months. Go more often.
Okay.
There are times where you may not be able to get a cleaning because your gums are so inflamed and irritated, but at least you can get a fluoride treatment. There are certain things that you can do along the way. You want to read about the products you're getting. There are certain ingredients you want to stay away from. Like a lot of toothpaste have sodium lauryl sulfate in it, which is what causes the foaming, but it also puts you at an increased risk for ulcerations. So if you're already on medication that can cause that, you don't want to use a toothpaste that has that in it, even if you're already using it and don't have any problems. All of that I feel is amplified during treatment. Want to find a mouth rinse that does not have alcohol because alcohol is more drying. So you want to look at all those things as well, which we have on our checklist, but you want to make sure you have that arsenal available for you. Start doing it before. Get in the habit before. Start flossing. Flossing to me is a huge thing. If you ask Abida and Shayna, it's in my car. I put it in Shayna's car, so I have it available when I'm in there.
That's your floss is your love language.
It's everywhere. It's everywhere. I keep it in my kitchen in a drawer. Like everybody gets floss, but that's one thing that people tend to pass over, and you need to start that before because that's going to help prevent smooth surface lesions. It's going to keep you from getting food impacted in your gums, which can cause inflammation, periodontal abscesses. It triggers so many things down the line. So if you can set that up before and be prepared and have the right products, it really is going to set you up for success and your team.
I have a question about floss. So I've gone down the wellness rabbit hole that says there's certain things you don't want in your floss. Like there's things in your floss that you don't even know is in your floss is this all true or is this?
It is. Read the ingredients. Some floss is made out of plastic.
Yeah.
And I think that's something people don't think, and you're flossing down into your gum tissue and you can cause bleeding. So there's blood supply there. Like definitely read all the packaging labels, read the ingredients, read how it's made. There's floss made out of cornstarch. There's floss made out of silk. There's so many different alternatives that are available now, which is amazing, that are even more sustainable. So read. That's my biggest suggestion is, I think there are so many things that we don't realize are in some of our products.
Of course. Yeah.
And also lip balm, right? A lot of people say, I put Vaseline, but Vaseline is an occlusive. It stops moisture from evaporating. It doesn't do anything for your lips. It's just something that blocks anything from entering,
Oh.
right? It's an occlusive. And moisturizing. So a lot of patients will complain about these tiny cuts that they get at the corner of their mouth. It's
Yeah.
called angular cheilitis.
I've gotten
Yes.
those too, and not going through
Mhm.
chemo, and
Right,
I
me
hate them.
too.
I don't know how to get rid of them.
So, moisturizing and then you put an occlusive, it's fine because at least something, and the skin of our lips is so thin.
Mhm.
It's very easily damaged, and chemotherapy can do that. So many medications can do that. Understand like what you're putting on your face or on inside your mouth and how it works. So, make sure you put a nice moisturizing lip balm, something that can help protect your lips, and then put something like Vaseline, which
Is
is
that like Eucerin too? Is Eucerin also
Yes, anything that
occlusive?
has petroleum jelly, I mean, that's just an occlusive. It doesn't help treat anything, right? You want something that has natural oils, something like sunflower oil or even olive oil or even beeswax, and then, that has ceramides, all of these things that will rebuild that layer on your lip that prevents the severity of angular cheilitis that can happen.
And
And then
the way I'm imagining it, and tell me if this is right, Abida. So I imagine you by putting on the oil, the olive oil, the whatever kind of product, that is what can help fix, like that's the treatment.
Correct.
And then by putting the occlusive, like the Vaseline or the Eucerin, that helps your medicine, so to speak, the oil stay in place.
Stay
Is
on.
that right?
Absolutely.
Okay, thank you.
Absolutely. That's what it does. Yeah. Yeah.
That's
So I
very
think
helpful.
yeah, and the other thing is also foods, right? When it's hard to eat, and everybody says, "Oh, have some cold ice cream, you feel better." Yeah, I'm sure you feel better, but that's not actually nourishing your oral
Right.
cavity or nourishing your body, right? So knowing what foods to eat, and I think preparing for that as well before treatment starts is so important. Again, the oncologist in his office is trying to get you the chemotherapy. He doesn't really have the time to sit and go through all of this with you, right?
Of course.
And then you go to Google, Dr. Google, and then there's so much conflicting advice there. You're like, what should I do? What should I not do?
Yeah.
I think, one of the reasons Robin and I went down this path was also to make sure that people know this is a place where you can trust what you're reading.
Yes.
We've
that
done
is
the work for you.
huge.
Don't worry
That
about
is
it. Just
huge.
do it.
I
Yeah.
think everybody's finding out that they can't necessarily trust everything that ChatGPT
Right.
is dishing out. Some of it's really cockamamie, right?
Yeah.
Like
Yes. Or
And then-
with on Instagram,
Yeah.
it was like
Oh,
buying
yeah.
oil. You don't know what these people's backgrounds
yeah,
are.
and the
that are going
stats,
in
yeah,
it.
they're just kind of like made up half of the time. So yeah,
And then one symptom that hasn't come up yet, and I've heard women talk about certain chemos can give them like a metallic taste in their mouth
Oh,
or like
yes.
Is there anything that can be done for that?
Yeah, so the metallic taste is actually so common, and that can be not just from treatment, but even through menopause. And women who have menopause will complain about that metallic taste. So that's just because estrogen is low in their body.
God, estrogen, what doesn't estrogen do?
I know.
I mean,
Estrogen and progesterone are just like your protective gods that sit inside your body and help you. And then as all of us go through menopause, just like how they have localized effects, in the vagina or in the genitourinary area, they have similar effects in your mucosa. So once, estrogen goes down, all of the same things that we talked that cancer treatment does, lack of estrogen does. So everything gets compounded twice over.
Interesting.
so what
Yeah.
can you do about that? Because I had that taste, and the thing is, they keep on telling you during chemo, drink tons of water. The water tastes like chlorine.
I know. So
It-
one thing that
yeah.
helps is, zinc. So zinc is
Oh.
supplement. A zinc supplement actually helps rebuild those taste buds. A B vitamin, having a good B vitamin complex also helps with the taste buds. And then using a good mouth rinse, like a bland mouth rinse is what it's called, constantly rinsing out those will help sort of rebuild the taste buds, the epithelium. We call it the epithelium, but just a layer of cells that helps the taste buds stay healthy. That is important as well. So, those things are very helpful as well. And then, eat right. Instead of maybe, get some mashed cauliflower and put a little bit of salt and eat that. I just constantly hear people say, "Oh, I can't eat anything. I'll eat pudding." And I'm like, "No, pudding's bad for you. Don't eat pudding."
No pudding for you.
It's
But
really
I'm a huge
Yeah.
component of tongue scraping.
Yeah.
Yeah.
That for me, like what is that?
Yeah,
I
let's
don't
talk
know.
about
I feel like it's
I,
keeping me really healthy. Like I'm like one of the baseball players with the, you know,
Yes, metallic
doing the
rubber ones.
traditions. Yeah, yeah.
Just
yeah.
think
So
about the physical structure of your tongue, right? There's so many little bumps and nooks and crannies where bacteria can hide.
yeah.
Um, just cleaning your tongue and getting that off is amazing.
And it's
It
also,
is
Breath.
during treatment, your mouth is so sensitive, right? Like
Yeah.
brushing really can be very hard on it. So even a slight scraping might help remove some of that plaque that develops even on your tongue. I
Wow.
think tongue scraping is good. We did that even starting as kids when I grew up.
So let me ask you this. If is part of your pack, is there a toothpaste or something that actually
Yeah.
helps? Yeah.
So, one thing to understand is that when you're undergoing treatment, fluoride can be very sensitizing as well in the mouth, right? So
Mhm.
your mucosa is so sensitive that fluoride can burn and cause that irritation. So we wanted to create a toothpaste that is without fluoride, but just gives you all of the benefits that fluoride can give you as well. So we have a toothpaste that's 10% nanohydroxyapatite, which is actually the mineral that your teeth is actually made of. That's what makes
Oh.
up your tooth. So what the toothpaste does is, and you can just smear this toothpaste on your teeth and go to bed, and it'll rebuild your enamel slowly. So your teeth get
Oh,
strong
wow.
over time. The cavities and the holes in them get filled. It's a great toothpaste. It also has xylitol, so it has this double whammy good effect where it prevents bacteria from growing. So again, prevents cavities. It has a very mild flavor. It has, all of these products that are very thoughtfully put in there intentionally for your teeth. So there's a toothpaste. Then
Hmm.
there is the mouth rinse, the soothing mouth rinse, which, so there are certain guidelines that are brought by National Cancer Institute, so NCI, and then there's an international organization called MASCC, and you can look it up, that is specifically designed for side effect management data. So, all of them say that having a bland rinse that has a balance of salt and soda in it, or bicarbonate, can help again soothe those oral tissues, and you should start using them in advance. So you want to make sure that your mouth is resilient, that the soft tissues in your mouth are strong, so that if you get sores, that they don't get to the level where treatment has to stop, or you have to go to ER, or we want to take you away from all of that. We want to help you manage some of these side effects at home. So a good salt and soda mouth rinse, which is there. We have these dry mouth candies, of course, which we love. They taste delicious.
I can
Sugar-free.
vouch for them. I've used them. I do thought they were wonderful. Yeah.
You tried them,
I
Jenny?
did. Yeah. Yeah.
Oh, we'll
I've
have to
tried.
get you some, Chris.
Yes. Where do you get them?
Website, well, on our ecom website. We have a remineralization gel, which is almost like a lip balm pen, but you paint your teeth with it. And
Oh,
so,
that's great. Yeah.
yeah, and then what it has is that it has potassium nitrate and calcium phosphate. Potassium nitrate is the ingredient in all of these whitening pens that reduces teeth sensitivity.
Mhm.
So your teeth sensitivity goes down. So you don't get that zing when you eat things or hot things or cold things. And then calcium phosphate again gets deposited in your teeth and rebuilds your teeth enamel. So we have that. We have this amazing lip balm that we love, and our kids use it, and everybody in the house uses it because it actually helps rebuild that the thin lip layer. It protects it and helps with angular cheilitis as well. We have that. We have this soft toothbrush, super soft bristles that is made out of bamboo. One thing that also worries me, and when in cancer patients, is you want to stay away from endocrine mimickers, right? So many of our cancers are driven through the endocrine pathways in our body, and so microplastics and chemical dyes, things like that, they all trigger those same endocrine pathways. So we want to stay away from plastics and dyes and things like that. So it's a bamboo toothbrush
Oh my
with
God, who would even
bristles.
think of that?
I
That's
was just thinking that
great.
too, right? Because they're most usually plastic, right? Is that like a lot of bristles?
Oh my God,
And
I
it's
don't
red
even
color.
want to use that my toothbrush anymore.
And
Okay,
it's red
okay,
in
I'm
color
learning. I'm
and
learning.
it's red and purple in color, and you don't know where those dyes came from. And dyes are notorious endocrine stimulators and mimickers.
I'm
Yeah.
throwing out all the toothbrushes in my house for my whole
Yeah.
family right now. That's
A bamboo toothbrush,
horrible. Yeah, we're putting it on our gums, which are okay.
yeah, in your mouth. So
Wow.
it's just because when you have cancer or you're going through treatment or even through survivorship, you're vulnerable. You want to protect and heal your body and try as best to stay away from things that can harm you, right? So I think So I think those are the products that we have in the oral space, but we also have a very amazing clothing line for cancer patients that we developed.
way.
Yeah, that's on the website as well. And again, that took us a few years because we wanted to make sure they're safe. It's the only clothing line that has an antimicrobial coating on it. It has these silver ions embedded, so it reduces your chances of infection. It's a
Wow.
quad set, so you put it on and you feel great. The material is organic cotton and organic bamboo. It's super soft, and it's your chemo day or your treatment day outfit. So you never have to think. It has all these adaptive zippers, so you never have to undress. You could be sitting in a chemo chair for 4 hours and you could be wearing it and nobody would know. You just open the zip and they can access your port or your IV site.
What
And
a
it
clever idea.
Yeah, and it has these Okotex safe dyes. So again, from 100, it goes through 100 different chemical tests to make sure that none of them can hurt you during treatment. So we have that as well because we want to ease the journey of patients.
So I think we could talk for 3 more hours, but I'm going to try to focus us on 2 things. One, Abida, you mentioned the biome, the microbiota in the
Yes.
mouth, which I mean, the microbiome seems like it's got its own publicist right now. It's real popular, but I haven't heard anyone talk about it in the mouth. So does the mouth respond similar to the gut? I mean, does eating yogurt help our mouth biome, or what are ways we can help that?
So first of all is to make sure you don't have an acidic mouth. Robin could talk forever for that. Robin, you want to talk about that a
Tell
bit?
us, Robin.
So, so pH is really important, right? Because you want to keep that good bacteria balance as well and keep the bacteria that can lead to things like gingivitis, periodontitis, soft tissue inflammation, decay. We want to reduce all that. So
Is that bad breath too? That hasn't come up yet, but what?
it can. I think
Can be.
dry mouth actually and lack of saliva flow can cause that. An acidic environment, sometimes reflux, things like that can also lead to it. Some people, when that biome is thrown off, you can get Candida, you can get a fungal infection. Anything, the tissue in your mouth goes all the way down through your body. It's the same thing in your GI system. So what impacts your mouth is going to impact the rest of your body as well.
Right. So you never think that you can get yeast in your mouth until
Correct.
your immune system is
Yeah.
knocked down. Yeah.
So it's important to maintain that balance. And simple things can do it. You don't necessarily need supplements or this. You can do it through maintaining your oral health.
Hydration, yeah. Just frequent hydration. Frequent hydration through the mouth rinse or making sure you drink, the right foods. Don't drink alcohol. No smoking, no alcohol, no soda,
Sugary drinks.
sugary drinks. I think avoiding that has such a positive effect on your oral microbiome. Using xylitol gum or xylitol candy instead of because that blocks strep mutans, which is the predominant bad bacteria in your mouth. They can't use it, so that's really good. Avoid alcohol containing mouthwashes. Alcohol is very drying to the mouth. So again, you're creating this dry environment that can trigger, that imbalance in the oral microbiome. And then foods, absolutely, absolutely. Make sure the gut bacteria, the mouth bacteria, everything needs fiber. The good bacteria in your gut needs fiber, and fiber can be many different types, right? So, we can have another session on that, but you make sure you're feeding all the good bacteria. That's what you want to
Yogurt,
feed them and
things
keep
like
them
that.
healthy.
Yeah. Even just certain foods like eating yogurt or
Right. Yeah.
Yeah. Fiber, low sugar, lots of, polyphenols, like green tea is really good, berries, cocoa, you like chocolate, take good quality chocolate. That's good for you.
That is the best thing I've heard all day. And then lastly, I know you did mention that a lot of the symptoms and struggles during chemo are similar during menopause. So I'm in perimenopause. Chris is going
Yeah.
through it a second time.
Oh.
I know a lot of our listeners. And again, I have questions just in general. I'd love to hear your thoughts. Also specifically about bone loss. What's the deal with bone loss? Because as a physical therapist, I'm worried about osteoporosis, osteopenia.
Yeah.
But is the clenching I'm doing at night helping build my bone?
Actually, it is.
Is it really? Oh,
Yeah, it is.
something for
That's
that.
why people who don't have teeth tend to have that recessed jaw because your osteoblasts and osteoclasts work really well when you chew, when you clench, when you grind. It's not great for your teeth.
Right.
But that's where it comes in with what Abida was discussing earlier about estrogen being a wonderful hormone that we have in our body.
Protective.
And helps maintain that bone.
Mm-hmm. So should we just double down on our calcium? I mean, obviously clear everything with your doctor first, but what are things we can do as menopausal women?
Well, definitely one thing you should do is, check your bone health, right? Getting a DEXA scan. I think everybody should get that. Know where you stand on that scale of osteoporosis or osteopenia. We know that, lack of estrogen makes bones weak. So your jawbone is also a bone, right? And then your
Right.
dentist can look at that for you as well. So, keep that in mind. And there are certain medications that actually can cause necrosis of this jawbone, and we call it osteonecrosis. But if you're on that, I'm sure your oncologist will definitely tell you about that. But you also can tell when, you're not able to get that good bite, right?
Mm-hmm.
And then, I think modern medicine and so much new data shows that, regardless of whether you have breast cancer or, any of the other cancers, there are ways to put you on hormone replacement therapy as well. It can be localized, depending on your uterine status, whether you have your uterus or no. There's so many things. So go to a certified menopause OBGYN and they can help you get the help you need. For sure, for sure.
Well, it's
That's such a
hard
great
having,
point.
yeah, well, there's so many mixed reviews about being a cancer survivor and going back on or going on any hormone replacements.
Well, I
So
think
that's,
that is changing. That so much of that data came from the black box warning on, getting estrogen replacement and causing cancers and causing
yeah.
all of that has changed. All of that has changed for the better. So that's why I'm saying that I know it's a scary thought, right? You don't want to, give your cancer something to grow back, but so much of that has changed. And really
Yeah.
depending on where your symptoms lie, whether it's localized hormone replacement therapy, for the health of your vagina or your genitourinary area, whether it's other things that are bothering you, hormonal therapy can be incredibly protective for your body. It's just that somebody needs to look at you as a whole person and see
As a
what.
whole person.
Yeah.
Because I know from my oncologist, she's
Mhm.
like, there's just not enough data. And yes, she talks about the thing that you did about, everything's changed and the data back then was misinformed,
Yes.
but there still is
But then I know your
worry.
doctor has recommended for other women. So it's back to Abida's point, right? About everyone
Whole person.
individual. Yeah.
See,
Yeah.
well, I was ERPR negative, so I don't know. She says she doesn't refer to different, but you just have to trust your doctor, whoever you're working with. I think each case is relative, but I definitely don't want people listening to think that, I know there's a lot of different points of view out there regarding, and,
Yes. Yes.
and
And the
me,
best thing you can do is educate yourself, right? Talk to your
exactly.
oncologist,
Yeah.
talk to your
Full
gynecologist.
circle moment, because back to as we started this podcast talking about on your website, which is it uncancer.com? Let's get that straight.
Is.
Yes.
There you have so much education, not only for you, but for your dentists, for your oncologists. So
Yes. And one thing to add too is that if you do go into osteoporosis from a medication you're taking, so my cancer was hormone positive, ERPR positive. So I couldn't have any estrogen, or, I can't have anything like that. But from the medication I was taking to prevent the breast cancer from coming back, did put me into osteoporosis. But after I was done, so I finished 7 years on it, went off of it, and doing my calcium, doing,
Yes.
the things I'm supposed to be doing, I'm now in osteopenia. So I'm
Hey.
seeing improvement with it. So, just something to say, to add that, like, if you do go into osteoporosis, it doesn't mean you're going to stay there. There are
That's
ways
great.
to make your
Yeah.
bones strong
Right.
again and get back to your normal range.
Oh, there's always ways for your body to heal. We're like aliens, I feel like. I had osteoporosis, osteopenia, and mine reversed too. I think, I'm a huge fan of, like you said, eating right and taking the
Weight training,
supplements when we're
resistance
depleting.
training.
Yeah,
Strength training.
I don't, I'm just not of the mindset where everyone needs hormone therapy to
Mhm.
fix the
Mhm.
thing.
Mhm.
I think there's
Mhm.
definitely other outlets for those of us who get advised through our oncologist that this is not a good
Yeah.
thing.
Agreed.
So there's definitely, I think research and learning and listening and reading not
So can you-
ChatGPT.
Each tell us, or we're going to start with Shayna as the marketing expert and the group. How do people find you? I mean, I love this idea. Full disclosure, have purchased some of your kits to send to friends who are going through chemo. So I think it's such a lovely gift. And now to know about the clothing line too. But how do people find you guys?
So we are on all the social media platforms. We're on Instagram, Facebook, LinkedIn, on TikTok. So we do a lot of social media promotions and things like that, contests, giveaways. So that's a great way to find out. Also, we, like I told you earlier, we partner with nonprofit organizations that help, promote, and we donate product for their care kits that are going out to patients, to hospitals, to cancer centers, things like
Wonderful.
that. So, yeah, there's
Uncancer.com.
And our
Come
website,
yeah,
Uncancer.com.
uncancer.com. None of the oral care products require a prescription, so it's
Great.
very easy. Also, the oral care products are FSA and HSA.
Great.
Uh,
Oh, that's clever too.
so you can use that for payment. And there is, and I love the idea of giving that as a gift, because it is very difficult to figure out what to give somebody when you find out a loved one has been diagnosed. And I know for myself, I mean, I received so many blankets. You can't count the number
Yeah,
of blankets.
we've heard that from
Yeah.
people.
And
And
fuzzy
socks.
Yeah.
Socks and blankets.
socks.
Yeah.
But this is a very practical gift that works, and it helps. And so there is a gift card option also on our
Oh,
site.
great.
So you could purchase that for someone, and then they could go on the site and choose what they want. So all of it's there on the website.
Amazing. I have learned so much, and I know there's still so much more I could learn. So I'm going to go to your website and read the blogs and see if I can get any of you to come back.
Yeah.
would love to. Thank you so
Thank
much
you so
for
much,
having us.
ladies.
Oh, this
Thank
was
you.
incredible.
Thank you.
Having you. Thanks.
Take care. Bye-bye.
Bye.
Bye. Thank you for joining us today on Boobalicious. Please don't forget to subscribe, like, and share this with a breastie who needs it. And also, don't forget to support our sponsors. We donate a portion of the proceeds to a charity that supports cancer patients in need. You can find us on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. Feel free to DM us on Boobalicious Pod. We welcome all questions and topic suggestions.
The conversations on Boobalicious are based on personal experiences and professional insight, but they are not intended to replace your medical advice. Always consult your doctor or licensed healthcare provider for medical guidance specific to your situation. We're here to support, not prescribe. See you next time.
Bye.
Bye.